This is distinct in its level of pervasiveness, as well as the intensity of the burnout that we're seeing.
Burning out, struggling with depression, and being crushed under heavy workloads. A new survey of Canada's physicians shows the growing challenges and impact on health and well-being.
Traditionally, residents who needed stress leave were few and very infrequent and did not require long stress leaves.
Resident physician Mary Jeffers was part of a Canadian Medical Association survey of more than 4,100 physicians, medical residents, and students between October and December last year.
More and more people are requiring time off for a variety of reasons, but a lot of it being mental health.
Nearly half of the respondents screened positive for depression, up from 33% since the CMA's 2017 survey. More than half reported high levels of burnout. Ramneek Desange with Doctors of BC pointing out the challenging state of the healthcare system in BC, only exacerbated by the COVID-19 pandemic.
We're overfilled in our hospital settings. I've got long wait times. Our clinics that our physicians are providing that support have had inadequate funding or to address the rising cost of business.
On Wednesday, BC's health minister committing $118 million in funding to family practices and walk-ins as a stopgap until the launch of a new pay model for physicians this fall.
This action will help stabilize our primary care system. It will ensure that family doctors can maintain their practices.
So we're hoping that this interim funding just helps them with a little bit of their overhead.
For those still working to become doctors, Jeffers says it's upsetting to see so much burnout.
As well as the satisfaction with our ability to do effective work because of staff shortages and limited access to facilities and testing that were not as big of an issue prior to 2020.
The CMA survey also suggests healthcare workers aren't fulfilled. Nearly 8 in 10 physicians and medical learners scored low on questions about professional fulfillment, and less than 6 in 10 say they're satisfied with their career in medicine.
I think we need to understand that our physicians are human. We're also patients. We also have to get care.
We need somebody who is well-versed in the literature to help us change the way that we structure our system and to provide us with care that we need to keep ourselves healthy.
In Vancouver, Kier Junos, City News.